Assalamu alaikum. Today we have a topic of epilepsy. This topic was under the supervision of pharmacy consultancy. Basically, work for pharmacy consultancy group. This is me, and my name is Imran Ali, and I am pharmacist. For, have done PharmD MPhil in pharmaceutics from Pakistan. Services we are only at WhatsApp, and we have a separate group for male and female students of pharmacy throughout Pakistan. We provide free notes, books, research articles, slides along with career counseling to fresh and graduates of pharmacy profession. We have just a little family and our aim is to help students having difficulty to find out the books, notes and slides. These services are totally free without any cost. So join us, be a part of Noble Services. Now let's start our topic, epilepsy. Basically, epilepsy, a neurological disorder in which sudden reoccurrence of episode of a sensory disturbance or it is a suddenly repetitive firing of neurons. Type of epilepsy, a primary epilepsy. This type of epilepsy happens without any specific cause. So sudden attack of seizure without any stimuli. It is also called the idiopathic epilepsy. Secondary epilepsy, seizures occurs due to the accidental head injury or lowering in glucose level. Meningitis, withdrawal of alcoholic addictions. Condition of epilepsy. On the basis of condition, the epilepsy is divided into two categories. A, partial or focal epilepsy. It can be developed into the generalized epilepsy. In simple case, patient is conscious and this can be happened in any stage. Complicated partial focal epilepsy, in which the patient is conscious and consciousness may be lost. In generalized epilepsy, we have category number one, that is the grand mal, conscious grand mal. In this generalized epilepsy, the consciousness is lost and tonic for 1 minute and clonic for 2 to 3 minutes, along with seizures and jerking of eye and violent muscle contract. Number two, absence of seizures, no tonic-clonic condition but impaired consciousness, rapid eye blinking founded. Number three, suddenly myoclonic epilepsy, suddenly involuntary muscle jerk or myoclonic muscles jerk. Number four, febrile seizure in children. Tremor occurs due to the increase in temperature. Children from range from 3 months or 5 years affect with the tonic-clonic seizure of short duration. Number 5, status epilepticus, a series of seizures including tonic and clonic seizures. Now this is a tonic phase and this is a clonic phase are mostly found in the epilepsy. Now let's start the treatment of epilepsy. There are two types of drugs that work as anti-epileptic drug that used for all type of epilepsy except the paracetamol. Number one, phenytoin, carbamazepine, phenobarbital. Number two, drugs that used for paracetamol seizures is valproic acid and ethosuximide. Phenytoin, it's a drug. Basically, it block mood of action. It's block a sodium channel and increase the refractory period and inhibit the major excitatory neurotransmitter, which is glutamate, which is basically escaped from the presynaptic neurons. Used for treatment of drug of choice in early seizure treatment, partial seizures, migraine, status epilepticus, and bipolar disorder. Toxicity, enlargement of gums, yellow-gray, brownish skins, osteomalacia, induction of E450, megaplastic anemia, and hirsutism. Peripheral neuropathy. Dosage is 10 to 15 mg per kg per minute, not more than 50 mg per minute. Children dose 1 to 3 mg per kg per minute. Phenytoin increase the metabolism of carbamazepine and phenytoin decrease the metabolism of isoniazid and sulfonamide, chloramphenicol and cimetidine. Pharmacokinetic of phenytoin it is roughly 90% protein bounded. Majority of phenytoin excreted as inactive metabolites in the body, and an estimated 1 to 5% of phenytoin is eliminated unchanged in urine. The half-life of phenytoin ranges from the 70 to 42 hours and is 22 hours on average patient. These are the drugs that are available in Pakistan for phenytoin active ingredient for single ingredient injection 250 mg or 30 mg per ml, suspension 30 mg per 5 ml, tablet 100 mg and capsule 100 mg. These are the brands that are available in local pharmacies in Pakistan. Now we have second drug, that is carbamazepine. Mode of action: it blocks sodium channel and increases the refractory period and inhibit the major excretory neurotransmitter, which is glutamate, which is escape from the presynaptic neurons. It is drug in trigeminal neuralgia. Basically, trigeminal neuralgia is a chronic pain status that affects on the trigeminal nerve, cranial nerve or cranial nerve 5. Partial use in partial seizures and generalized tonic-clonic seizures, also bipolar disorders. Osteomalacia, induction of E450, aplastic anemia, ataxia, agranulocytosis, water retention. Adult 200 mg oral after every 12 hours, maximum dose of 1600 mg per day. Children 10 to 20 mg per kg per day and orally for every 6 hours. It has a teratogenic effect, which is craniofacial abnormality spina bifida. Treatment of carbamazepine requires a liver functioning test. Pharmacokinetic: carbamazepine is 75 to 80% bounded to plasma protein. Carbamazepine is mainly excreted at a hydroxylated and conjugated metabolites and minimal amount of unchained drug. The mean half-life of carbamazepine was 30 to 40 hours. These are the brands are available in Pakistan regarding the carbamazepine drug. For single ingredient, it's syrup 100 mg per 5 ml, 100 mg suspension 100 mg per 5 ml, tablet 200 mg 400 mg strength, tablet sustained release 200 mg, capsule sustained release 200 mg and 400 mg. These are the brands available in Pakistan along with the retailer price. Another drug we have a phenobarbital. Mode of action: increase the duration opening of chlorine ions channel, causes the decrease in neurons firing. Basically, activation of GABA inhibitory neurotransmitter action either by increasing influx or potassium ion influx. Treatment: treat the partial and tonic-clonic seizure. Anxiety seizure used in the anxiety sedation anesthetic. Toxicity: it is called ataxia, CNS depression, diplopia, respiratory and also CNS depression, induction of E450 system. It has a food drug interaction. Avoid alcohol with phenobarbitals. Limited caffeine intake. Take on an empty stomach. Taking this medication on an empty stomach increase the speed of absorption. Dosage 10 to 40 mcg per liter or 43 to 172 micromoles per liter. Children 5 mg per kg per day, oral or IV. Treat overdose with system management. There is no antidote for phenobarbital, and assess the ventilation and increase the blood pressure. 20 to 45% bounded to plasma protein. The mean elimination half-life is 53 to 118 hours. These are the brands available phenobarbital in Pakistan. Single ingredient 100 mg or 100 mg per ml, 200 mg per 2 ml in as injection. Elixir 20 mg or 20 mg per 5 ml, tablets 30 mg. Multi-ingredient, it is also available in 25 mg. These are the brands of phenobarbital available in Pakistan. Now we have another category for anti-epileptic drugs. The mode of action it blocks is ethosamide. Mode of action it blocks the T-type calcium ion current in the thalamic neurons. The drug of choice for absence seizure. It is called as toxicity, which is gastrointestinal distresses, fatigue, Steve Jones syndrome, hepatotoxicity and respiratory depression. Pharmacokinetic absorption, bioavailability after oral administration is 93%. Hepatic metabolism via hepatic system through CYP3A4 and CYP E21. Half-life is 53 hours. Dose is in capsule form 250 mg. Adult dose is 40 to 100 mcg per ml. Children less than 3 years old, safety and efficacy not established yet. This drug is not available in Pakistan, but in of the Pakistan. It is manufacturing by Pfizer Pharmaceutical in the name of Zorotin in 250 mg per 5 ml. Now then, the last we have a drug is valproic acid. It blocks the T-type calcium channels. It also inhibits the GABA transmission and block of axonal channels. Treatment: it is used to treat the absence seizure, means patent mull and minor epilepsy. It will also treat the migraine headache and restoring the balance of certain neurotransmitter. It is also used in bipolar disorder. Toxicity: it causes a tremor, weight gain, hepatotoxicity, gastrointestinal distress, induction of P450 system, interact with the phenytoin and carbamazepine. Also, hematotoxic drug. Pharmacokinetic absorption is approximately 90%. Metabolism: this is mainly metabolized in the liver via glucouronidation 50%, beta oxidation 40%, and sigma oxidation 10%. Note: it has a teratogenic effect, which is neuronal tube defect in the fetus or spina bifida. Half-life is 13 to 19 hours. Doses available in 100 mg per ml, 250 mg, 250 mg per 5 ml, 125 mg per 500 mg. Maximum dose is 60 mg per kg per day. Children less than 10 years old, safety and efficacy are yet established. This is all about the presentation. Kindly, if that we have the uh, drugs available in a single ingredient in Pakistan as valproic acid in suspension form, 250 mg, and tablet 250 mg. This was manufactured by Ansel Pharma, but this is not nowadays available in Pakistan. So we have a valproic sodium instead of valproic acid, and these are the brands which are manufacturing available in Pakistan. A single injection is available in 500 mg syrup, 200 mg per 5 ml, 200 mg per 5 ml, 250 mg per 5 ml, and 500 mg per 5 ml. Suspension 200 mg per 5 ml. Tablets in tablet form it is 125 mg, 200 mg, 250 mg, and 500 mg. These are the brands which are manufactured in the Pakistan, and their prices are listed below. So this is all about our presentation. Kindly do subscribe our channel and join the pharmacy consultancy WhatsApp group. Thanks for listening and watching. I hope this will be helpful for you. Take care. Allah Hafiz.